Hello everyone, welcome to the Government Information Service. I'm Leslie Ann Johnson, and in the studio with us today is Mrs. Hannah St. Paul. She's a Senior Community Health Nurse, EPI Manager in the Ministry of Health, and we're just seeking to clarify some issues so that the public can be better at ease. It is good to have you in the studio.
Thank you.
All right, first of all, we're talking, of course, about the coronavirus, which we know is a major concern to people at this time. What are some of the steps that Grenada has put in place to ensure that the public remains safe in terms of, people coming in on the airport? We just want to make sure people are screened, just to ensure, of course, like I said, people are safe.
All right. Good morning to everyone. And as Ministry of Health, it is our responsibility for the nation's health, right? And it wouldn't be or benefit us at the Ministry of Health or our citizen to speak what is not true, right? So when we give information to the public, we are speaking from facts. We are trying every day to tell you what is happening as truthfully as we can. And as a Ministry of Health, it is our responsibility whenever there is some sort of communicable disease out there to prevent or minimize the risk as much as possible for this condition entering our nation, right? In relation to the flight that entered Grenada, right, and everyone, we are a little bit concerned about it, and it's justifiably so. We would have, as a Ministry of Health, activate our pandemic surveillance protocol. And that is there, as I say, for any communicable disease that is out there, we have to protect our shores. And on that morning or that night in question, I want to say to you that at the airport, we have a health team there. We have nurses working. On that day, we didn't have any nurse at the airport, on the airport roster, to cover that flight. Therefore, we had to make a decision from the ministry to send one of our senior public health nurses to the airport to conduct our normal screening assessment that we do when we have situations like that. So a nurse did board the flight. The nurse was geared in her protective gear, and she entered the flight, right? She did a screening of all persons that was on the flight. She took their temperatures. She took a history. She assessed them to ensure that they didn't have any symptom relating to corona, like cough, sore throat, complaints of feeling unwell, and that was done. We didn't just leave it at that. Another public health nurse was assigned to these persons. Fortunately for us, all of these persons were living in the same environment or the same place. So we didn't have one person going from here to there. So it was really good that we had all the persons living at the same place. So that nurse was assigned to go to that place and continue monitoring of these persons. And these persons were monitored from the time they entered into the country until they left the country.